As we can see here, there is a redness over the elbow joints compared to the other normal tissue. Here for comparison between the two arms, there is a redness and there is also swelling. If we ask the patient about the pain, of course he will have pain. في موجود هنا أماكن. تفضل. Acute inflammation marked by what? Increase of the inflammatory cells, especially the white blood cells, and more specific for the neutrophils, which is the segmented neutrophils. Why segmented? Because the nucleus are segmented into multiple loops. Here we are in the alveolar space. What we can see that the vascular spaces will be having the fibrin and the neutrophils, the white blood cells, the RBC will be going from the vascular spaces into the extravascular spaces. This process of inflammation can be memorized by what? There will be a vasodilation, so the blood vessel will be dilated. That's why the inflammation and the RBC and the red blood cells will be going out to the extravascular spaces. This will be clinically as a redness. في شيء؟ في شيء؟ طيب هي كذا بس ما راح تكون أكثر من كذا. The other process will be the vascular permeability. As we know, the blood vessels is lined by what? Endothelial cells. So there will be leakage between them that enhance the content of the blood vessels will go out to the extravascular spaces. Or there will be endothelial cell injury by what? By the chemical mediator. Third one is the exudation, which is by osmotic pressure or by hydrostatic pressure, that the fluid will go out from the blood wall to the extravascular spaces. The fourth one is the vascular stasis, which is the bloodstream will be slow at the time or at the site of the inflammation. So this also will lead, the fluid will be going out, and this will lead to what? To the swelling. Here is a diagrammatic that shows the dilatation of the blood vessels, which is lined by these endothelial cells. As we said, there will be an injury or leakage between the endothelial cells that will allow the content to go out. The content عبارة عن إيش؟ Red blood cells, neutrophils, which is the white blood cells, fibrin, chemical mediators, and albumin also. So what is the chemical mediator that promote this vasodilatation? It's the prostaglandin, the histamine, and the nitric oxide. This is an animation to show what? The neutrophils, how it goes from the no. This is an animation that demonstrates how the neutrophils is going out from the vascular wall into outside. There is a margination rolling over the endothelial cells and on the surface of it, and then margination into outside. These all helping by what? Mediated by a series of events. One of them is selecting ICAM1, CD34, myeloperoxidase. All these will help the neutrophils to roll out over the endothelial cells. Here the diagram shows what? This is the basement membrane. These are numerous neutrophils. It's going outside through the basement membrane into the extravascular spaces. The collection of neutrophils, we call it as abscess. Here, it's a fibrin mesh. This one is a fibrin mesh, and these are the neutrophils embedded on it. Clinically, the patient will have swelling. Under the microscope, you will see fibrin mesh and neutrophils. This is the same as the previous one, but there is some changes, which is these small rounded organism. This is gram-positive cocci. This can be seen in acute pneumonia. We can see that the neutrophils is engulfing the cocci, and some of them are surrounded by the neutrophils. The complement will help the neutrophil to be activated. It's a cascade pathway, classical pathway that help to activate the neutrophils to go to the site of the inflammation. Some of them called C3b, C5a. This is important. Why? Because it have to be in the normal cascade in order to the neutrophils to be activated. Here we have blood vessels, which is obscured the lumen by the fibrin. The blood vessels is not normal. Why? Because the neutrophils has destroyed the blood vessel wall, and there is a hemorrhage also. This is why, because the neutrophils, when it is attacking the organism or attacking the tissue, it will destroy all the tissue, the normal and the abnormal one, the organism and the normal tissue. This is a higher magnification of the same vasculitis. We can see here a debris, which is a necrosis of the blood vessel wall. Here we have several inflammatory cells. We can see the largest one, which is the macrophages, and the segmented nucleus, which is the neutrophils. We have also these cells with large nucleus and rim of cytoplasm. This is called the lymphocyte. You can see it in the chronic inflammation. We can have also this one, eccentric nucleus and cartwheel chromatin. This is called the plasma cells. The macrophages can eat the normal and the organism also. So you can see here that there is neutrophils inside the macrophages and RBC with fragmented nucleus. This is a simple edema. Edema means fluid collection beneath the tissue. Why it's called pitting edema? Because after putting a pressure on this side, after removing your finger, there will be a depression on that side. It means you have put a pressure on a fluid. Here is a simple example of a fluid collection. This is a friction blister. So the fluid collection or the edema, it depends on the site of it. Something could be a very trivial example, and something could be life-threatening. Like here, we have the laryngeal edema. This is a life-threatening situation. So it's depending where the location is for the edema. This is a fluid collection. This is the pleural cavity, and the fluid is pale to yellow appearance. That is compressing the normal lung. We have two types of fluid. One is called the exudate, and the other is transudate. Simply, we can memorize it like if it is rich in protein or cells, it's an exudate. If it is depleted or low in protein and cells, it's a transudate. Furthermore, there is a description for the transudate. We have serious transudate, we have serious sanguine. في شيء؟ نعم. خلاص اسألني أنا بعدين. Serious sanguine fluid or effusion, which is with the red blood cells, fibrinous. If there is a fibrin here, and purulent if there is a numerous neutrophils in the fluid. So we'll see some examples. This one, as we can see, it's red. So it's containing hemorrhage or blood. So it is serosanguine effusion, which can be seen that bilateral effusion. Here is purulent or could be, this is the peritoneal cavity. So it's a chyle. Chyle what? It's a lymphatic. If there is a blockage in the lymphatic, there will be a lymph, simply called a chyle ascites. This could be due to malignant, like lymphoma. We have the heart. As we can see, there is a strand of fibrin between the parietal and the visceral layer. So this one, as it's containing the fibrin, it's called fibrinous effusion. Here, microscopically of the fibrinous exudate, we can see it here the strand of the fibrin. And here is the pericardial surface. We can see scattered neutrophils in the myometrium. Here is the colon. We can see yellow to green exudate on the surface, and it is composed of what? This is a debris or necrotic tissue. This is the heart also. We can see it's a dark yellowish. So this one is a purulent. If we see it under the microscope, we'll see numerous of neutrophils included in it. And here is the meninges. We can see there is an exudate obscuring the sulci, so we can think about Streptococcus pneumoniae that can cause this one beneath the meninges. Here is extensive exudate, and it is yellow in color, so we can think about purulent, which is infection, and it is composed of mainly of neutrophils. Here is an example of alveoli. This one, we can see numerous of neutrophils included in it. So the patient will be presenting with what? If the neutrophils is in the alveoli, so the patient will present it with productive cough. The patient will be coming with sputum because of the infection in the alveoli. This one is the gallbladder. We can see the neutrophils in the mucosa and the submucosa. Because it is the gallbladder, the patient will be presenting with right upper quadrant pain and tenderness on the same side. So it is a case of acute cholecystitis. Why acute? Because the neutrophils is there. Here is the same as the previous one of the lung, but there is more extensive neutrophils in the alveolar spaces. So we can think about more aggressive organism like Pseudomonas aeruginosa. We can see dilated blood capillaries. This is the lung with abscess formation in the upper lobe and the lower lobe, after drainage, of course. Here also we have several of abscess formation. These can be seen on the radiograph or X-ray as an air fluid level. This is a simple abscess or much micro abscess as we call it. Here is the myocardium, and we can see there is a collection of neutrophils surrounding a purple organism here. So this is the bacteria and this is the neutrophils surrounding it, trying to engulf or to taking off the organism. This is the lung also. There is micro abscess overall, extensive. Here all of these, the small yellow dots, is an abscess formation. This is an extensive neutrophilic exudate. Why? Because I cannot see where the originated the organism is, or the organs where it is, because there is no normal tissue here. So it's an extensive exudate. Again, this is the alveoli, and this is extensive neutrophils, but we can see here the normal tissue, not like the previous one. What's the result of abscess formation and acute inflammation? It is an ulcer. and ulcer has a serious complication, specifically if it was in a hollow organ like the stomach or the colon. Here is the stomach. We can see a large ulceration. Why we say this is an ulceration? Because this is the normal tissue, and this is the normal tissue. Here there is a skip of the normal tissue, a flat lesion. So this is an ulceration. Here is the epiglottis. Here is subglottic ulceration. This is why, because of the intubation, the patient has an endotracheal tube that was very fit or tight to it. So this is a pressure, ulcerative pressure. Here we have the esophagus. Why we say the esophagus? Because this is stratified squamous. We can see it normally on the esophagus. Here we have a skip of the normal mucosa. By what? Here it's a debris and fibrin and with inflammatory cells. So this is ulcer. This is a patient who having diabetes mellitus. Why patient having mostly amputation or unhealing ulcer? Because they have marked arteriosclerosis and arterial narrowing. So any trival trauma to the leg or to the extremities is having a serious complication, like this one is unhealing ulceration. Again, this is another one example of diabetes patient, and because of the arteriosclerosis, the tissue will goes under necrosis, or as we call it, gangrenous in diabetes. This is below knee amputation. This is the large ulcer base. Any question? Any question? We finished.